Good evening, everyone. Thank you for joining us and tuning in today. My name is Colin Spikes, and today I will be doing the controlling function.
My name is Dominic Connor. I'll be talking about planning.
My name is Jacaylee Minor, and I'll be talking about organizing.
My name is Claudia Regus, and I'll be talking about the leading function.
Today, we will basically show you how these four functions are implemented into the Methodist Hospital and also provide insights on how they can improve on these functions and how they can engage with other hospitals and also as they're competing with other hospitals. As the top performer in the country, Houston Methodist sets a high standard for healthcare excellence.
So let's go ahead and talk about planning. Usually with companies, they have a form of strategies when they come down to planning. And the five keys strategies are basically setting up a goal, which they use an acronym called SMART, which is make sure the goal is specific, measurable, realistic, and all in a timely manner. Also developing communication, as you see with the pictures, with developing communication, is all about make sure you and your partners are able to work together, think of a plan, figure out what to do within achieving your goals. Also with achieving actions, effective actions, and also tracking progress. It's all about statistics and also making sure what we have used, what resources do we have to use, what we see more in percentage of the goals and what we're trying to achieve to our goals. And make sure at the end of the whole process, the strategy is minimizing flexibility, which is seeing what is the least that we have to do to gain what we want to achieve in our goals. Now, that's more into Methodists. Methodists use this procedure along with, say, their rehabilitation center, and also it goes along with their operation planning, and also goes down to emergency planning. More within those organizations, I will pass it on to Kelly.
So I will go over the Houston Methodist medical staff organizational structure. So they have a hierarchical structure ensuring effective leadership, governance, and clinical oversight across all medical and administrative functions. So at the top, they have their executive committee, which is the top governing body for medical staff comprising key officers. They have their president-elects, their secretary, their EVP CEO designee, and their chief medical officer. Next, we have the medical departments, and their role, specialized departments led by chairs managing clinical practices and quality in their areas. And they have cardiovascular surgery, family medicine, neurology, and urology. Next, at number 3, we have medical staff committees. They focus on quality, credentials, and governance standards. They have quality management, credentials, bylaws, and rules. And then at number 4, we have subcommittees and special programs, which address specialized care in hospital operations. They have antimicrobial stewardship, sepsis management, operating room oversight. And then at number 5, they have specialty centers, which focuses on advanced treatments and research hubs with dedicated leadership, which is their cancer center. They have emergency services and transplant. And lastly, they have quality and patient safety initiatives, which they have a chief quality officer over that and also a patient safety committee. And this diagram over here basically explains or visualizes more of that.
So I'll be talking about the leading function, which is the process of motivating and encouraging and inspiring employees to perform to the best of their abilities to achieve organizational objectives. And Methodist, it follows the I-CARE values, which is integrity, compassion, accountability, respect, and excellence. These values are exemplified by the staff who provide value-based care to patients. They also have an employee volunteer program called iCare, in which employees volunteer in community organizations. One of the leading methods that Methodist uses is that they invest in continuous education to encourage and motivate employees. They also provide training and professional development opportunities to provide staff with the necessary skills promoting teamwork and collaboration access in the departments. These are one of the programs that you use. Another leading method that they use is that they have they empower the employees by giving them a voice. They have the employee resource groups, which are voluntary groups created and led by employees. They are based on common interests, backgrounds, and demographics. These groups help create a diverse and inclusive workplace, and these are some of the programs that they have.
And lastly, we come to our final management function in our sequence, which is controlling. Controlling, in short, is pretty much just the process ensuring that the organization's plans are carried out and that also the organization meets its goals. As you can see the definition right here, controlling is the regulatory process of establishing standards to achieve an organization's goals and also comparing our performance to those standards and taking our corrective action when necessary to restore our performance. And honestly, we will touch on that when we get to our controlling cycle in the next slide. But first, we can touch on our purpose. The purpose of controlling is to ensure that an organization operates effectively and efficiently. Controlling isn't a one-time achievement. It takes daily, weekly, and even monthly attention. And as you can see here in our controlling cycle, you may ask, how does it pertain to Methodists? Well, first we have setting our standards. Through setting their standards, the hospital places rigorous operational and clinical standards aligned with healthcare regulations, patient safety guidelines to cater to the organization's goals. For example, doctors and nurses can ensure infection control, and they can also focus on timely medication administration to their patients. Second, as you can see, we have measuring our performance. To measure their performance at Houston Methodist, the hospital utilizes robust tracking systems and metrics. For example, they can use regular audits of patient care and operational processes. They can also monitor key performance indicators like patient outcome, average length of stay of the patient, and also staff efficiency. Third, we have compare actual performance to our performance standards. Also in the hospital, they compare actual performance to their performance standards. So the hospital compares the collected data against its predefined standards. They do this by creating internal reviews or even reports on if quality care meets their expectations. And also they can analyze patient feedbacks through surveys and maybe even focus groups that they may have within the hospital. And also they can benchmark performance to see if they are competing well against their competitors in other hospitals as well. And lastly, the last component in our controlling cycle is our corrective action, which is taken when deviations from the organization's standards occur. At Houston Methodist, they implement staff training programs to address any skill gaps or deficiencies in knowledge, even within their staff, or maybe providing knowledge to their patients as well. And also they can revise processes and technology to improve efficiency in, say, surgical scheduling to improve on delays, or making overflow of patients in need of care to make sure that the overflow doesn't occur. Through this, they implement and schedule patient or even staff transfers so everyone can receive timely care. And lastly, we have our methods of controlling. This shows the coordination of the resources and also communication within the organization. As you can see, we have three main methods of controlling, which is feed forward, concurrent, and also feedback. For feed forward, this proactive approach is common in preventive healthcare. It involves assessing patient risk before surgery and also implementing infection protocols, as I spoke in our controlling cycle, and our third, which is comparing our actual performance standards. Second, we have concurrent control, which is real-time monitoring. It's crucial in hospitals, especially as they compete with other hospitals around the country. And also with areas like the ICU within the hospital where patient vitals are continuously tracked for immediate adjustments. Lastly, we have feedback control.
And this is pretty much our conclusion. If you have any questions or concerns, you can reach out to our group leader, Claudia, are our group members: Dominique, Kylan, Jacaylee,
And Claudia.
and these are our emails. And on the side, we also have our references listed. Thank you for listening to our presentation.
Thank you.
Thank you.